Hi, everybody. Welcome to the Limitless Run Masterclasses. My name is Asha. I'm a social worker with Limitless. And thank you all for joining us and watching us right now. So, a quick introduction to the Limitless Run. It's our annual run for hope, whereby whatever money was raised in the run will go towards providing more resources, providing more treatment, and providing more counseling sessions to young people who reach out to us for help in the coming year. If you like to talk to us or reach out to us, you can find us at hello@limitless.sg, or you can connect with us on Instagram at we.r.limitless, as well as on TikTok at limitless.sg. Right. So if you happen to also know someone who is living in depression, or you would like to kind of explain depression to someone else, we have an application that you can use and you can download, right? It's called A Day in the Life. And by going through the application, you'll be playing through a visual novel that will allow you to kind of like live a day in the life of a young person struggling with depression. And your choices will determine the way her day ends. It's going to be a great tool to be used to kind of help someone who doesn't understand depression learn a little bit more about what it entails. Yeah. So, like I mentioned earlier on, the Limitless Run is our annual fundraising run whereby we try to raise enough resources to provide support for the young people that reach out to us every year. This year we've had more than 700 people reach out to us, right? And of that 700, more than 28% of them struggle with suicidal ideation. You know, your donations are important to us. If you would like to give a one-time or even a monthly donation, you can go to give.asia/limitless to support our work. All proceeds will go to our helpline, casework counseling, and mental health outreach. It costs us about $65 for every hour intervention. And here's where it goes. Our helpline provides short-term therapeutic support for young people who may not be struggling with such or severe issues. Sometimes a little bit of distress, a little bit of like struggle, but what we have, are social workers and counselors who are at the ready to provide, on-the-go support for them for up to 3 weeks. It also serves as our triage, whereby we identify more severe cases that will enter into our casework and counseling program. And when we think about casework and counseling program, it is our way of treating young people who struggle with mental health issues. We provide treatments such as cognitive behavioral therapy, EMDR, right, and multiple other psychotherapy modalities, whereby we also provide case management for young people who may be struggling, right, with their mental health and need more support, maybe from their families, from their schools, who may need support from a hospital as well. Part of this also includes crisis intervention. As earlier mentioned, 28% of the youths who reach out to us struggle with suicidal ideation. And often, right, our caseworkers are busy at night, engaging them, engaging their families and preventing them from escalating, their issues as well. So if you would like to kind of support us, do follow us. And, I will encourage you to give to our programs at give.asia/limitless.
So I have no affiliation to any other organization. I'm not funded by any drug company. Also, that is the disclaimer. So I thought webinar is a very interesting way, right, in this day and age. And while the pandemic has posed a lot of difficulties, it's also really good that we are now able to give a talk at home. So just a few minutes ago, I was mopping the floor, and then here I am delivering a talk right now. So I'm going to be talking about losing sleep over insomnia. I hope you can see the slides. I actually lost a lot of sleep while doing these slides because I could only do it at night. And yeah, it's the irony of things. Actually, I lost a lot of sleep because of this presentation. Yeah. So without further ado, I hope you don't fall asleep during my talk. I'll try to make it as interesting as I can. Yeah, so I'm going to share with you a story kind of to bring you through the patient journey so that you have a better understanding of how the whole process would be like. So this is Su Ying. She's a VP in the bank, very young VP. She's a high flyer. She loves yoga. She likes her fairly traded coffee. She likes cooking, and she likes to watch shows like Selling Sunset on Netflix. So she has a very supportive boyfriend as well. Now here's the boyfriend. But she has a dark secret, or maybe not so dark, but she must be home every night by 9 p.m. It's even earlier than Cinderella, right? So why does she rush home so early at night? Actually, she has a very specific routine that she has to do at night. When the night falls, right, she actually gets very tense. So she has to rush home. She got to kind of settle herself down. She will take a shower. She'll read her newspaper. She'll drink her chamomile tea. And then she has to watch a very specific show called House Hunter, where she finds the voice of the narrator very soothing. And then she must be in bed by about 10 to 10:30. So on most nights, she is able to sleep fairly okay. On some nights, she will be very tense. She couldn't sleep. And this is what's going to happen. She's going to text her boyfriend. Let's see what she texts. She's going to text like 11 o'clock. She'll say, oh my God, it's 11 already. You should have stayed up so late. Then after that, in an hour's time, oh no, it's midnight. I had the sleepy feeling earlier, but I don't have the sleepy feeling now. Why is this happening to me? At 1:15 a.m. she texts, oh no, my face is going to sag. I have an important meeting tomorrow. So all the vulgar words get censored by iMessage already, right? Yeah. So what's going to happen after that? And I'm so angry now. And a lot of her negative thoughts starts to come up. I'm not going to be able to drive tomorrow. It's 2:30 a.m. I ate the leftover pie, but I still can't sleep, and now I'm going to gain weight. So by 3 a.m. she says, I give up. Yeah. So she's obviously very angry. She's very exasperated. She's very anxious, and she couldn't sleep. So what happened to her is that she decided to look for help. It's really affecting her. So she went onto her iPad. She looked for information on insomnia, and then she found out about this sleep center, and it's located in many hospitals. This is the SingHealth ones, and she's staying in Sengkang, so she decided she will go to Sengkang General Hospital to seek help. So this is Sengkang General Hospital, in case you never had a chance to travel all the way to the Sengkang Punggol area. And there she is, at level 6, filling up all the forms. So she decided to come and seek help because she realized that this is actually a 24-hour problem, right? When she can't sleep at night, in the morning, she'll be very groggy. She cannot focus. She's present, but she's actually absent, right? That's what we call presentism. And then sometimes when she couldn't sleep, she would have thoughts like, okay, I'll just take MC the next day, even if it's working from home. And we know that people with insomnia, they do have a higher chance of developing other medical conditions like depression, diabetes, high blood pressure. So she decided, okay, I'm going to finally seek help right now. So she's going to fill a series of questionnaires. This was actually done by my colleague. You get the same sets at Singapore General Hospital. There are actually many pages of questionnaires, which are very good. I actually did them myself last night. It took me a while to finish them, but they are very, very comprehensive. They ask, actually, if you do all these questionnaires, by the time you walk into my room, right, it's pretty much my job is done. So really very comprehensive, 9 to 10 pages of questionnaire asking about mood, what time you sleep, what time you wake up, are you a early person, are you a night person? So it's really a lot of information to fill up. So she comes to my room, and then I'll again go through the history of her again, asking her, verifying the things that she wrote down, things like what time she lies in bed. So she says she goes to bed at 10, but 3 to 4 times a week she can only sleep at 1, and then she'll wake up by 6, and then she doesn't want to get out of bed until 8, but she doesn't really wake up in the middle of the night. Now, sleep hygiene is a bit about hand hygiene. We ask them things like, do they wash their hands, but how is their sleep habits like? Like for her, she likes to drink coffee during high tea, right? So that's not exactly great news because coffee can be in the blood for several hours. And then she like to lie in the bed even when she's not sleepy, and now that she's working from home, She tries to take naps when she can, for about 30 minutes during lunchtime. But the good news is actually she exercises every day. She likes to do yoga, right? She likes to hit the gym. She likes to go for spinning classes. So that's the positive part of it. So I'll check with her about her mood. She says she doesn't feel sad, but she's very, very anxious. She worries about not falling asleep. And then when the night falls, right, this is when she starts to feel very tense. And she finds that she gets very angry when she cannot fall asleep. She's quite a go-getter. She's always used to getting what she wants. She's not so stressed about working from home anymore. She have kind of gotten used to working from home. She's quite a high flyer. She's not worried that the bank will let go of her. But she worries that the company will use this as a reason not to promote her as they promised. In the bank, it's quite complicated, right? You need like a lot of sponsors to get you to be promoted, maybe to senior VP. And she's also getting a house with her boyfriend. So, she's surfing property guru at night. Her brain get very activated when she look at the prices of the houses and trying to find out the location. Is it near MRT? So all these things are keeping her up. She doesn't have any other abnormal sleeping problems like snoring, or like not breathing in the middle of the night. She, for short periods, not throughout the night, of course. She doesn't experience any pain in her legs. There are no abnormal movements. She doesn't drink. She doesn't use sleeping pills. But she did note that her dad had anxiety problem as well. Her childhood was okay. She's a graduate. She has no medical problems. She's not on any long-term medications at all. Now, this is important because some medical problems can affect sleep. Like Parkinson's disease and some medication can be activating. So it's important to find out whether they have all these issues or not. So here is Swing asking me. So I have insomnia, right? Okay, I got a message from my friend asking me if this is a real patient. So I'll tell you whether this is a real patient in the end or not. So she says, so I have insomnia, right? So let's look at how we define insomnia. So here we actually use we actually follow guidelines. Psychiatry is not really something you can, psychiatric condition is not something you can really decipher through lab tests or through brain scan. So we actually follow a certain guideline. The one that I use more often is this diagnostic criteria called DSM-5. So let's look whether she fulfills the criteria for insomnia disorder or not. So, okay, she has difficulty falling asleep. She wakes up quite early in the morning. It happens at least 3 nights per week. And this is present for at least 3 months. So she does fulfill the criteria for insomnia disorder. Now, even though she gets it periodically, like once or 2 months, and then she's okay for a few months, generally in a year, she gets it for at least 3 months. The criteria is not very clear. Is it 3 months continuously, or is it over a period of 1 year? But I mean, she is quite bothered by it. She does experience the problems with it. So I would still diagnose her with insomnia disorder. So she asked me the next question, is insomnia common or not? Is it common in Singapore? Now, there's a study done in 1996 in Singapore. I think they did it somewhere around NUH, and they survey a few thousand people, and they find that the prevalence of insomnia in Singapore is 15.3%. Yeah, so this is based on 1996 study. And interestingly, they find that females tend to get it more than males. Now, this is quite true with overseas studies as well. And a lot of people who have insomnia have more stresses than people without. Yeah, and the most common stress is actually their kids, followed by their parents. But to bear in mind, this is 1996, although I think maybe the proportion of stress from kids and parents are going up, right? These days, the climate for education is very competitive. Children are going to school at like 2 years old and have a lot of tuition classes, right? And then parents spend their weekend fetching their kids from one center to another, although I think a lot is home-based now, which is another set of problems. So she asked, this is a very common question, right? What causes insomnia? Now, insomnia is not like COVID-19, right? It's not because of a virus and then you get the symptoms. Now, in many conditions like diabetes, high blood pressure, insomnia, many medical conditions actually are multifactorial, meaning that it is like from A, B, C, D, E, F, G, they work together to cause the insomnia. So it's not A resulting in B kind of scenario, but really a constellation of factors coming together. So from the history that Suing gave me, right, what do you think are the causes? Now let's think back about what she said, right? So this is by C.W. Lewis. I wonder if you know who he is. Maybe you can try and guess who this person is. He wrote a very famous book, right? It's the Chronicles of Narnia. So he says that many things, including going to sleep, are done worse when we are trying our hardest to do them. So it's true, right? I remember that night. I had an important meeting in the morning, and the harder I tried to sleep, actually, the harder it got, until I kind of like just gave up. And interestingly, when I gave up, actually I could sleep. So in Suing case, if we look at the so also in psychiatry, often we use this model called the biopsychosocial model. So what are the biological factors? What are the personality or the psychological factors in the person's life? What are the social stressors that she's experiencing that are contributing to her insomnia? So she has a few, right? She's of the female gender. Already from the studies and from many studies, we know that female gender kind of increase the risk of insomnia. Or her father had anxiety, so there could be some genetic basis to that. That's all the psychological factor. Maybe she's very, very anxious about sleep. Almost like as if she has anxiety disorder already. She also say that she's a go-getter. When things don't go her way, she gets very angry. And she does have some sleep hygiene issues, right? She takes coffee. She lies in the bed all the time, even when she's not sleepy. And then she's stressed over house buying. She's not very happy that the company may not be promoting her as planned. So this is again a very common question that many patients ask me, including Sui. She's like, I just want to sleep 8 to 9 hours or even 10 hours every day. Why is that so difficult? Now, maybe if you are listening right now, let's ask yourself, how many hours do you really sleep? Is it really 8 to 9 hours? Actually, because of this presentation, I've been sleeping 5 hours every night. Yeah, because I did one set and I wasn't very happy. Then I changed the whole presentation again. So it's quite ironic, right? I lost a lot of sleep over this also. So let's look at famous people, famous successful people. Do they really sleep 8 to 10 hours every night in order to be successful? So Indra Nooyi was the previous CEO of PepsiCo, right? Barack Obama, the previous president, and Tim Cook, the CEO of Apple. Now let's see how many hours they sleep every night. So none of them actually sleep 8 to 10 hours, right? Indra sleeps 5, Barack sleeps 6, and Tim sleeps 7 hours. Yeah, so even like famous scientists like Einstein, Thomas Edison, they've been very famous for sleeping very few hours every night, and they seem to be quite productive. So actually, the amount of time that everybody needs is very different. Some people needs more, some people needs less. So when Suing has this preconceived notion that she must sleep a certain hours in order to function, it actually works against her, right? Because when she cannot meet her expectations, then she gets upset. So her next question is, if that's the case, do I need a study to confirm whether I have insomnia or not? Yeah. So as I mentioned previously, we use it based on the diagnostic criteria. I don't really need to do a test on her to confirm her insomnia. Although sometimes it's helpful to do some physical examination and blood tests to see whether there are other things that are causing her insomnia. For instance, in a woman of age, if I notice a goiter on the neck, I might do a physical exam to look out for any signs of hyperthyroidism, or maybe I will do a thyroid test to check her blood level, see whether the thyroxine level is increased or not. Also, all these are quite helpful. But she doesn't really need a sleep study per se, although we have the facilities in many hospitals, including Sengkang General Hospital. So the answer is generally no. We don't order a sleep study. Now, the other time when we order a sleep study is when we think that there are other comorbidities or other conditions we want to rule out. Let's say she reported she had abnormal behavior when she sleeps, like she will trash around in bed, or she tells me her snoring is very bad. She sleeps long hours, but she's still very tired in the day. Then we'll do sleep studies, because then that can be quite helpful. Now, this is the Clinical Measurement Center in Sengkang General Hospital. They measure clinical things, obviously. So this is the example of a sleep study. They look at the brainwave pattern, the oxygen level, and there's a lot of wires that they have to hook up, and the patient has to stay overnight. Yeah, surprisingly, some of my patients sleep pretty well when we send them for sleep studies. I think it's also because they are sleeping in a different place. They're not associating their own room. Because a lot of times people associate their own room with like torture. When people can't sleep, when they lie in their own bed, they feel like torture. So sometimes they sleep better at other places. So that could be a reason why some of them could fall asleep despite having so many wires tied to their all over their body. Now, we also have bright light therapy. This is more for things like delay sleep phase, although some studies shows that it can be quite helpful for insomnia. So it shines a bright blue light into the eye, to stimulate, to regulate the melatonin production from the pineal gland in the brain. I tried it on before. I thought it would be very glaring, but interestingly, it's not very glaring at all. You can wear it. You can even kiss your partner while wearing it. No problems with that. So this is not really so much for insomnia. It's really more for like things like delayed sleep phase disorder, especially in a lot of boys, right? They sleep very late. Boys as in teenage boys, not like school kids, primary school kids, where they sleep very late and then they wake up very late. So this kind of help to move their internal clock a bit. So she asked me, what can I do? What can I do to help sleep better? Yeah, so many a times we have many suggestions for our patients, but there are often a lot of limitations also. Sometimes there are things like time constraints, they may not be willing to go for a lot of very intensive intervention. So simple things that I always tell my patients are things like sleep hygiene. This is our own pamphlet. So we will go through some simple sleep hygiene advice with them. So we show them the pamphlet and try to circle the things that are relevant to them. So in her case, it's things like avoiding caffeine, right? She drinks coffee for high tea, so that is not good for her. And to go to bed at the same time and wake up at the same time every morning. If she wants to nap early, you can see that actually she checks her phone quite frequently, right? She's sending all sorts of texts to her boyfriend, Ashwin. So actually, she shouldn't be doing that, isn't it? She should be like, the more she looks at the phone and then she starts to do a countdown, right? Oh, now it's 10. I'm going to wake up at 8. Now it's 11. So she kind of see that the amount of time she's sleeping is getting shorter and shorter. So she end up adjusting her wake up time also, right? She resets her alarm every hour, or maybe I sleep 20 minutes more, That kind of drive her anxiety up. So the advice we give to our patients is not to put the clock, or in this day and age, handphone next to their bed. Yeah. So when she's not sleeping and then she's in a lot of torment, it actually makes things worse. So what we tell our patients to get out of bed, maybe go to the kitchen, or go to another room, do something very boring. And then when she has the sleepy feeling, try again. So there are other advice here that may not be so relevant to her. Also, these are sleep hygiene advice. So what else can she do? She's already doing exercises, so that's very good. I will encourage her to continue doing that. Although don't do it too near during before sleep, because when we exercise, our body temperature actually goes up, and that makes it harder to sleep. So if she want to exercise, maybe evening is good, but not like 1 hour before she wants to sleep, she go for a jog. Singaporeans are very good at jogging, right? I mean, we heard Professor Chris Cheng, Nicholas Chua, even myself, a lot of us had to go night jogging. And after jogging, it's going to be very hard for her to sleep. Now, what else can she do besides exercise, sleep hygiene? I think we hear from previous speakers that mindfulness is very big in our hospital. And certainly I've attended a lot of courses, training, workshop on mindfulness. So one good thing that I bring from my training in my organization to my patients is teach them some mindful breathing exercises. So studies have shown that it has good effects. It's recommended. I've gone through quite a few guidelines yesterday, and it's recommended in quite a few guidelines as well. The European guideline in treatment of insomnia, the Kaiser Permanente guideline. So meta-analysis or scientific studies does show that it has some benefits. So this is all of us in the auditorium doing mindfulness exercise. Although in this day and age, if you see a picture like that, you'll freak out already, right? There's no social distancing at all. So it's all virtual now. Okay, so don't report me. So she asked, are your sleeping pills addictive? Yeah. So the thing is, now this is the pharmacist talking to her. So in Sengkang, we do have a pharmacist to kind of talk to our patients after they see the doctor. So there are some medicine that are addictive indeed, and these are the actual sleeping pills, the benzodiazepines and the Z drugs. Now, I'm not going to tell you in details how each of them work. I think this is more a lecture for doctors and medical students. But suffice to say, those that are addictive, I would advise my patient not to take it every night. I give it to them very sparingly, maybe just 10 to 20 tablets as a backup plan, On nights when they're desperate, they really want to sleep, they can take it. They have their own side effects. And if they take it regularly after about 3 to 4 weeks, like they take it every day, then there's a chance that they might develop tolerance and they might develop dependence to the medication. It means that they need more and more of this medicine to sleep. And when they don't sleep, they actually develop withdrawal problems. So for the real sleeping pills, we are very careful with it. And we use more other medications like antidepressants or antihistamines, melatonin, and sometimes even antipsychotics to help them get that sleepy feeling. Now, for her, I would say that antidepressant may have a role because she's actually quite tense, she's actually quite anxious, right? So the antidepressant, even though it's taken early in the morning, can actually help her reduce her level of anxiety and her rumination when she goes to bed. Her ruminations about sleep when she goes to bed at night. This is the antidepressant that I often use called trazodone, and the pharmacist is explaining to her using the tablet. So she read about CBTI, cognitive behavioral therapy for insomnia. Is it effective? Well, the answer is it's very, very effective. As good as medicine, if not better, based on many studies. But the problem is that if she wants to do CBTI, then she has to be very motivated. She has to come, ideally, even every week or at least once to 2 times a month, see my colleague, Mark, and other psychologists. And then they have to really commit to coming very regularly. And the problem with many patients is after 1 or 2 sessions, when they don't see any improvement, they kind of drop out. And it's pretty much like learning to play the piano, right? If you just go for 1 or 2 lessons, you're not going to be able to master anything at all. So you have to come regularly. You have to go for at least 6 or 7 sessions before you see any improvement. And it takes time. So it's a package of things that Mark will teach Sue-Ying. Educate her on insomnia, on sleep hygiene, teach her how to associate the bed with a sleepy feeling, relaxation techniques, cognitive therapy. So cognitive therapy could be very relevant to her, right? Because she has all this negative thinking that is not going to be very helpful. So they will actually teach them to do like a thought record, I can't sleep by 11. She gets very angry, and these are the thoughts that go into her mind. So she can be taught to challenge all these difficult thoughts, turn them into something a bit more helpful. Like, if I doesn't sleep, it doesn't mean I cannot function the next day. If I can't sleep for 1 night, it doesn't mean I'll be lousy the next day. So when she reevaluates the option, actually her anger may not be 100% this time. Maybe she'll rate it as 90% or 80% or 70%, anything to kind of soften these kind of unhelpful thoughts. So the good news is that for people who can't come, actually there are apps that are shown that have very strong evidence that they are very helpful. CBTI coach is by the veteran. I was in Stanford recently for attachment, and they do use these veteran apps very regularly. Yeah, so this is Sue-Ying at the end of the whole consult. A few months later, this is Sue-Ying with her boyfriend, and her colleagues, celebrating that her sleep has gotten a lot better. You can see that she's a lot more cheerful. Now, interestingly, the guy in the white polo tee is the one who came up with who helped to contribute to the questionnaires. Yeah. So if you have insomnia and you are really struggling, do seek help. You can see your family doctor. You can see the doctor at the polyclinic. We do go down to the polyclinic to give talks to our colleagues at the polyclinic very regularly. You can see a psychiatrist. And by now, I think maybe you have guessed that actually Sue-Ying is a psychiatrist. She's not a patient. She's actually a very, very intelligent, very kind-hearted psychiatrist. She also does some mindfulness research. Her specialty is actually in people above the age of 65. Really someone I'll trust my life with. And there's also sleep center in many hospitals, including Tan Tock Seng, Sing Health, and that's the team. That's my colleague Kai Hong. So that's all of us. You can see Sue-Ying, you can see her boyfriend is really not her boyfriend, but another psychiatrist in my department. Yeah, so with that, I thank you. I know I'm a bit short of time already. And I told you not to sleep, right? But you may sleep now. Okay, thanks a lot for your attention.